Hi, my name is Luis Guzman, and today I'll be presenting my project on grief support for children and families, with a focus on the survivors of suicide support services offered at Adventist Health Glendale. This program plays a crucial role in supporting individuals and families who have lost a loved one to suicide. Here's what I'll be covering today: an overview of the agency, the impact of youth suicide, the services provided, community and family healing, supporting statistics, and finally, a summary of key takeaways. The survivors of suicide support groups operate under the Beyond Loss Bereavement Ministry and Chaplains Department at Adventist Health Glendale. Although it's housed in a hospital, the program serves as a community-based human service agency open to anyone affected by suicide loss. Their mission is to provide a safe and structured space where survivors can share experiences and heal collectively. Services are low cost or no cost, making them accessible to a wide and diverse population. Before going further, I want to clarify a few key terms used throughout this project. A human service agency provides community-based support to improve well-being. Survivors of suicide are individuals who have lost someone close to them due to suicide. A bereavement support group is a space where people meet regularly to share their grief together. And the Beyond Loss Bereavement Ministry is the broader program that organizes grief groups, training, and events. Youth suicide remains as a pressing concern. Nationally, it is the second leading cause of death for ages 10 through 34, and in Los Angeles County, it's the third leading cause of death for ages 10 through 24. In California, self-harm incidents among youth have increased by 50% in less than a decade. And every suicide affects more than 100 people, including family, friends, and community members. This is why local support is so essential. The Survivors of Suicide program provides a healing environment within the community, allowing survivors to connect with people who understand their experiences. Because the program serves a culturally diverse Los Angeles County population, it helps normalize grief, reduce stigma, and promote reconnection with school, family, and faith networks. The agency's approach is holistic. They address grief physically, emotionally, and spiritually. As a faith-based hospital, Adventist Health Glendale emphasizes compassion, dignity, and respect for every individual. A key part of their philosophy is healing through shared experiences, understanding that people feel supported when others truly relate to their loss. The program offers support groups for adults, adolescents, and teens, individual counseling upon request, volunteer and facilitator opportunities, low-cost fees or fee waivers, and regularly scheduled support meetings at 1509 Wilson Terrace. These elements together create a consistent and accessible support network. The program welcomes anyone affected by suicide loss. There are no geographic restrictions. Because of this, families from many backgrounds can receive support that's culturally sensitive and inclusive. The program's sustainability relies on hospital operating funds, community benefit programs, philanthropic donations, and a small one-time registration fee. This blended funding model helps ensure that services remain accessible to all families in need. These support groups have a significant impact on families. They help normalize difficult feelings like guilt or anger, improve communication among family members, reduce isolation and stigma, and strengthen daily routines and social support systems. Looking at long-term trends, youth suicide rates have risen in both California and Los Angeles County. These numbers highlight the increasing need for grief services. Again, each suicide affects more than 100 people, showing just how far-reaching the impact can be. Therefore, the survivors of suicide support groups at Adventist Health Glendale provide essential services to families navigating one of the most painful experiences imaginable. Their holistic and community-centered approach normalizes grief, reduces isolation, and encourages reconnection. Through continued support, survivors of suicide loss are able to find emotional, social, and spiritual healing. And this concludes my presentation on grief support for children and families.